If you're watching this right now, there's a good chance you're sitting very carefully, maybe leaning to one side, maybe on a folded towel. Maybe you've been dreading your next trip to the bathroom for hours. And maybe, like millions of people over 50, you've been suffering quietly because this is the kind of pain nobody wants to say out loud. I want you to take a breath. You're in the right place. In the next few minutes, I'm going to walk you through 3 simple, gentle methods that can calm hemorrhoid pain almost immediately. Methods you can use tonight, right at home, without anything fancy. But before we get to them, there's something important your body is trying to tell you, and once you understand it, the relief actually lasts longer. Hemorrhoids are one of the most common problems after the age of 50. Doctors estimate that more than half of adults will deal with them at some point. And for seniors, they tend to show up more often, hurt more sharply, and take longer to heal. That's not a coincidence. It's biology. But here's what most people don't realize. Hemorrhoid pain isn't random. It's a signal. The swelling, the burning, the itching, the bleeding. Those aren't just symptoms. They're your body waving a small red flag, telling you something specific about pressure, circulation, and the tissue down there. When you understand the signal, the 3 relief methods I'm about to share will make a lot more sense, and they'll work a lot better. So let's start there. Inside and just outside your rectum, you have small clusters of veins. Think of them like tiny cushions, soft and stretchy, that help control bowel movements. They're supposed to be there. Everyone has them. Hemorrhoids are simply what we call those veins, when they become swollen, irritated, or pushed out of place. And what causes that swelling? Pressure, plain old pressure. Sitting too long, straining on the toilet, constipation, hard stools, heavy lifting. Years of standing on concrete floors, pregnancy decades ago that left a weak spot. And this one matters most for seniors, the simple fact that as we age, the connective tissue that holds those veins in place becomes thinner and looser, so they bulge more easily and they take longer to settle back down. That's why a 35-year-old might have a flare-up and forget about it in 2 days, while a 65-year-old can suffer for 2 weeks from the same trigger. Now, the pain itself tells you which type you're dealing with. A deep, dull ache with bright red blood on the toilet paper usually points to internal hemorrhoids. A sharp, throbbing, burning pain you can actually feel with your fingertips usually points to external ones. And a sudden, intense, almost stabbing pain, sometimes with a small, hard lump, can mean a thrombosed hemorrhoid, which is when a blood clot forms inside the swollen vein. That last one is still treatable at home in the early stages, but it's the most painful version, and it's worth knowing about. Okay, now that you understand what's happening, let's get you some real relief. Method 1. The warm sitz soak. This is the oldest and most reliable method in the book, and there's a reason doctors still recommend it after 100 years. A warm sitz bath relaxes the muscles around the anus, increases blood flow to the area, and gently shrinks swelling. Most people feel noticeable relief within 10 to 15 minutes. Here's how to do it properly, because most people do it wrong. Fill your bathtub with about 3 to 4 inches of warm water. Not hot. Warm. If it's too hot, you'll irritate the tissue more. The water should feel like a comfortable bath, around body temperature or just slightly above. You can also buy a small plastic sitz basin that fits over your toilet seat. Those are easier on the knees and back, which matters a lot if you're a senior with joint pain. Sit in the warm water for about 15 minutes. You can add a 1/4 cup of plain Epsom salt if you'd like. Some people find that helps, some don't. What you should not add is bubble bath, scented oils, baking soda in large amounts, or anything perfumed. The skin down there is already inflamed, and fragrances can make the burning worse. Do this 2 or 3 times a day during a flare-up, and especially after a bowel movement. When you get out, do not rub yourself dry. Pat gently with a soft towel, or even better, dab with a clean cotton cloth. Rubbing is one of the biggest mistakes people make. That alone, done correctly, can drop pain levels by half within the first day. Method 2. The cold compress reset. This one is the opposite approach, and it works on a completely different mechanism. Where the warm soak relaxes, cold therapy constricts. It tightens the swollen blood vessels, numbs the nerve endings, and brings down inflammation fast. For sharp throbbing pain, the kind that makes you wince when you sit, cold is often the quickest relief you'll find. Here's the safe way to do it. Take a small ice pack or a bag of frozen peas and wrap it in a thin, clean cotton cloth. Never put ice directly on the skin. Sit or lie on your side and place the wrapped cold pack against the affected area for about 10 minutes. Then take it off for at least 20 minutes before reapplying. That 10 on, 20 off rhythm matters. Leaving cold on too long can damage delicate skin, especially in older adults whose skin is thinner and slower to heal. A small trick that works wonderfully: take a paper cup, fill it 3/4 with water, freeze it, then peel back the rim so a smooth dome of ice is exposed. Wrap the bottom in a cloth so your hand stays warm, and roll the ice gently over the area for a few minutes. The cold is more even, and the pressure is more controlled. Many people alternate: warm sitz bath in the morning, cold compress in the evening. The contrast actually helps the swollen veins shrink faster than either method alone. Method 3. The positioning and toilet technique. This third method isn't a treatment. It's a behavior change, and it's the one that stops the pain from coming back the same night. Most hemorrhoid flare-ups get worse because of what happens on the toilet. We were never really designed to sit upright on a modern toilet. That 90-degree angle puts pressure exactly where you don't want it and makes you strain harder than you should. For older adults with slower digestion, that strain is often what tipped a small irritation into a full-blown flare in the first place. Here's the fix, and it costs nothing. Place a small footstool or even a stack of 2 thick books in front of your toilet. When you sit down, put your feet up on it so your knees rise above your hips. This shifts your body into a gentle squatting position. It straightens the lower bowel and lets stool pass with almost no pushing. People who switch to this position often tell me they didn't realize how much they were straining until they stopped. A few more things that make a huge difference in the moment. Never sit on the toilet for more than 5 minutes. Don't read. Don't scroll your phone. Long sitting puts direct pressure on those swollen veins, and gravity pulls them downward. If nothing's happening in 5 minutes, get up, walk around, drink a glass of warm water, and try again later. When you wipe, switch to wet wipes, the unscented, alcohol-free kind made for sensitive skin, or simply rinse with warm water using a small squeeze bottle. Dry toilet paper on inflamed tissue is like sandpaper. You'd be amazed how much pain goes away just from changing how you clean yourself. And during a flare-up, try not to sit on hard surfaces for long periods. A soft cushion, ideally a donut-shaped or wedge cushion, takes pressure off the area while you watch TV, eat, or drive. That small change can mean the difference between a peaceful evening and a painful one. While those 3 methods give you immediate relief, your body still needs softer stools and steadier circulation to fully calm down. So drink more water than you think you need. Most seniors are quietly dehydrated, and dry stool is hemorrhoid fuel. Add a soluble fiber source like ground flaxseed, oats, chia seeds, or a daily prune or 2. If your doctor approves, a fiber supplement like psyllium husk can be a quiet hero. Move your body gently. Even a 10-minute walk after meals improves blood flow and digestion. And avoid lifting anything heavy during a flare. That includes grandchildren, grocery bags, or moving furniture. The pressure travels straight down. I want to be honest with you because you deserve straight talk. Most hemorrhoid flare-ups will calm down within a few days using these methods. But there are situations where you should not wait it out at home. Please get checked if you see dark or maroon-colored blood instead of bright red. If the bleeding is heavy, soaking through pads or the toilet bowl. If the pain is severe and a hard, painful lump appears suddenly. If you have a fever, dizziness or weakness, along with rectal bleeding, or if symptoms last longer than a week despite home care. And anyone over 50 who has rectal bleeding for the first time should mention it to their doctor, even if it seems mild. It's almost always something simple, but other conditions can mimic hemorrhoids, and ruling them out gives you peace of mind. Hemorrhoid pain has a way of making you feel small and alone, but it shouldn't. It's one of the most common, most treatable, most ordinary problems your body deals with, especially as the years go by. The warm sit soak, the cold compress reset, and the change in toilet positioning aren't fancy tricks. They're 3 quiet, reliable tools that have helped people find comfort for generations. Use them tonight. Use them gently and give your body time to heal. And remember, every twinge, every flare, every sore moment is your body asking for something simple. Less pressure, more water, softer movement, kinder care. When you give it those things, it usually responds faster than you'd expect. If this helped you understand what's going on and gave you something useful to try tonight, take a moment to subscribe. We make videos like this every week, focused on the small, practical health changes that make a real difference after 50. And if you know someone who's been suffering quietly with this, share it with them. They may not say it out loud, but they'll thank you for it. Take care of yourself. You deserve to sit comfortably again.